how the heck did you become the biotoxin lady?
I developed full body hives that no one could figure out. I'm sticking my face in a bowl of ice water every morning. I just didn't look like me. I didn't feel like me.
At least 50% of all American buildings are water damaged. That is going to be 2 billion patients.
Financially, they're out so much money. It gets expensive when you're not going the traditional route. So
all right, gang, it's a super special day on the Vitality Hour. We got the biotoxin lady, who I actually call the queen of clear education in CIRS and mold illness, Lauren Lowenstein. How you doing, Lauren?
I am good. I'm good. How are you?
Oh, I'm so pumped that there's people like you out in the world that are keeping it clean. And I know we've been connecting regularly lately, and it's just so uplifting to know that you're out there. And I just love that you don't fudge, that you are a clear, clean, effective communicator that's based in peer-reviewed, reproducible, published work on mold illness and CIRS. And I'm just stoked to have a conversation today to hear what's going on with the people in your world. And just really curious for our listeners to understand, how the heck did you become the biotoxin lady?
If you had told me a year ago, this is where like my life would be, this is where I would be, absolutely would not believe it. My story is long, just as many people's is. Years of, going through the system and going from doctor to doctor to doctor, getting diagnosis after diagnosis, which, we know are just symptoms of a deeper problem. And I'll backtrack. We actually sold a brand new home and moved into this home back in 2019. And the home that we sold, it's pretty wild now. We sold that home to a family who left their home, lost everything because of toxic mold. And never, like in all the years of being in our home, did that ever cross my mind? Did I ever think like, what if it could be our house? And so lo and behold, we move into our home, and within, I would say, a few months, I started having symptoms. I didn't know I was having symptoms. It's so much easier to look back and connect the dots. But it was, I developed full body hives that no one could figure out. I had splitting headaches and migraines, and I was having just severe muscle pain, mostly in my neck and my shoulders, my back. But I lifted really heavy at the gym. So I just attribute it to everything, right? Like, I'm getting older. I'm a mom of young kids. I don't get a lot of sleep. Just a lot of little things like that. I had been diagnosed early in my 20s with interstitial cystitis and endometriosis, a number of things. Like it had always been something in my whole life. Again, you can kind of connect those dots now. But once we were in this home and those symptoms continued to progress, and my depression was always a battle. But my kids were also having a lot of issues, and I still never kind of correlated. I just thought, well, they got my crappy genetics, which they did, but totally. I didn't know.
What does that mean?
Right. Yeah. But we moved in and behavior changed pretty drastically. My oldest son was saying things that like a 5-year-old should not be saying. Like, why did God even make me? Like, I don't want to be alive. Or the good me went away today and the bad me was here, and I don't know what happened. And Mom, what happens if I get lost in my head again? And so these behaviors and their GI issues and their headaches and their leg cramps and wetting the bed, all of these things continued. And my symptoms over the years continued to wax and wane, I would say. But the very last year, I was kind of at the peak of my fitness in the bodybuilding world. Going to be stepping on stage and competing in the next, coming months. And my world just completely came out from under me. I, along with all the symptoms I had already had, GI issues, bladder issues. I had migraines and headaches and fibromyalgia and POTS. Um, but I started to get really severe neurological symptoms. Like in the gym, the entire left side of my body was not working right. I couldn't pick up the same weight that I could with my right hand. And then I started feeling like I had, the best way I can explain it is I felt like I was trying to squeeze into my kids' Spider-Man costumes. Like it
Mm.
felt like I had this layer around me on the inside of my skin that was squeezing me to death. And it was just odd things that if I went to a doctor, they're like, I don't know. I don't know how to help you. And I was having derealization. So I kept feeling like I am not in this world. This is not reality. And at times I'm like, are those my kids? Like I felt like I didn't recognize my own family. And I would cry to my husband, like, if I don't come back, please fight for me. Cause I feel like one day I'm going to wake up and not be here. And everything just continued to progress and progress. And I had really intense tremors and I was not really able to function with my hands and my thumbs. Um, it was pretty bad. And I became like bedbound. My husband was doing everything. We had grandmothers that were, trying to help with kids. And so at that point, I was always trying to do my own research. I'm a researcher and I just continued to try and figure things out. And I'm like, everything really is looking to MS. Like that I
For
can
sure.
kind of make sense out of.
Yeah, those
I didn't want to believe
neurological.
it.
Yeah,
Right.
for
I'm
sure. Those
like,
feelings in the gym where your one part of your body's not working anymore, it's going to scream MS.
I'm like,
And it's going to scream
this is,
MS to the doctor, right? They're going to
yeah.
put you in that box.
I'm like, this is not good. Um, and the more severe it became, even my husband was like, kind of wrapping his mind around it. It does seem like it, looks like it, smells like it, all the symptoms are there. And, when I pursued it with neurology, um, it still makes me mad even thinking back on my team and how long it took me to get into neurology because
Mhm.
the system just sucks. And I hated the doctor, but I was like, I can't wait until, I see another doctor. How long is that going to take? And, um, and basically everything just, I had a lot of, like I was dealing with what seemed like optic neuritis. And then I had an MRI that was unspecific. And I'm like, what does that mean? They're like, we don't know what that means. We need to, there's just a lot of things thrown around. But saying that, yeah, it kind of seems to maybe be MS, atypical MS, because you've got all the symptoms, everything correlates. I was actually put on steroids and it was like, and this is going to blow your mind. I was put on 5 rounds of steroids in like a 6-week period.
Wow.
And that took me down really, really hard. Um, and I make sense of that now because I was dealing with CIRS, like I'm not dealing with MS. But was told like, then we'll repeat MRI. And I never did do that because that's kind of, I was in the throes of, I remember at one point even asking the neurologist, as soon as mold was kind of on my radar, I mentioned mold and she laughed and said, mold is never going to cause neurological symptoms like this. And, I really like put it out of my mind. I'm like, okay, like probably not. Right. And sent along my way. And then it was kind of a whirlwind because then I came across Michaela Peterson had made a post
Yep.
about CIRS and nothing real detailed, just like posted it and about her family, made mention of Shoemaker. And I still didn't even think about it for myself. I sent it to a friend. I'm like, hey, this sounds like you. And then the more it kind of resonated and I started looking into it, I was like, this makes more sense because I didn't feel like I had MS where it was coming in flares. It was like, it was either there or it was just super severe. There was no kind of in between. But the more I connected the dots, I'm like, my kids, this sounds like this could make sense because my kids are having symptoms. And that's when I really dove into, okay, I think we need to do an ERMI, test our house. I was actually working with a functional medicine doctor who worked with mold patients. He never brought mold to my radar. And I'm bitter about that. Because I had cried in his office. He knew all my symptoms and he never.
It's a 5 to 7 minute questionnaire to screen for it.
I mean, it could have just put it on my radar but he has since reached out to me, saying, hey, I'm seeing a lot of my mold patients with neurological symptoms. So, but it's just that wasn't put on my radar and I had to figure it out on my own. So, that's what sent me down the rabbit hole. And I found the labs and I went from doctor to doctor. Hey, can you order these? No, go to someone else, go to an allergist, go to, and I finally was able to get them run. And my husband and I sat there and we dove into everything and we found the Rosetta Stone and we pieced everything together and we're looking at the labs and we're comparing them with, Shoemaker's labs. And there we're like, yeah, this is a CIRS diagnosis. And that's a whole story with my husband and I and getting him on board as it is with many partners. But once he's a data guy, he's an engineer, and he was like, now this makes sense. There's like actual measurable, quantifiable data here that I can work with. And so he, kind of started down the rabbit hole. I always say I got us to CIRS and then he took the reins because I was done. And but he came across you and it was a podcast and listening to you. And I think in one of your podcasts, you were talking about those suicidal ideations and that really hit home for him because of what he knew I was struggling with. And so I always say that you were a very pivotal moment in our journey and kind of getting him to take it seriously.
Well, if I can get a husband who's an engine nerd and explain the peer-reviewed reproducible medical literature of Dr. Shoemaker that we've now contributed to, they totally get it. They're the easiest because they think like a scientist, right? They think objectively. And the only difference between humans and your husband's job is it's complex systems, right? It's systems on top of systems on top of systems, but they totally get it. They're the easy ones. So yeah, so that, and we openly talk about suicidal ideations, the depersonalization, because people need to know they're not lazy or crazy. And people need to know that all mood disorders known to humans are published to have higher levels of inflammatory cytokines than healthy controls who don't feel those symptoms. So if you have OCD or ADD or depersonalization or bipolar or schizophrenia or depression or major depressive disorder or anxiety, they all have higher levels of inflammatory cytokines in your brain. And not all of them are CIRS, but they all have higher levels. So you could get depressed from a concussion or sleep apnea or a tooth abscess, right? But you were on the fast track, in my opinion. And I know you now, and I know the story, and I know the freaky deaky feeling. Like the creepiest thing you said is not recognizing your kids. Like that's messed up, right? And so, but relative to the patients, I diagnosed an 83-year-old with CIRS who was tired since she was 11. Like she's actually going to feel better in her 80s and 90s than she did when she was 50. And she's cobbled together some semblance of a life. She plays ukulele. She hangs out with her church ladies. She does a little volunteer work. But it's like she's been tired her whole life and just been parroted back her symptoms, right? She says, I'm tired all the time. And the doctor says, you have chronic fatigue syndrome. And the patient should say, wait, I just told you I'm tired all the time and you told me I have tired all the time syndrome? You can go tell your spouse about what a great diagnostician you are, right? I have muscle aches and you said I have fibromyalgia. I also have a smartphone and algia means pain and myofibers mean muscles. So I just told you my muscles hurt and you told me
slapped a fancy name on it.
my muscles hurt?
Yeah.
So I want to hear the rest, but I'm going to tell you it's very common as in naturopathic medical school or in conventional medical school to even if you get exposed to mold, it's asthma, allergies,
Yeah.
rhinitis, sinusitis. And I'm like, what causes those? Inflammatory cytokines.
Hmm.
So I have grass pollen allergy. And when the grass pollens go up, I get congestion and rhinitis, but I also get depression. And people need to know it's not like a personality disorder. Your histamine went up from the
Right.
grass pollen, and high histamine causes depression.
Right.
And so I don't know why it was so far out for doctors, including myself, to understand that if you have rheumatoid arthritis, you're going to have more propensity for mood disorder. If you have Crohn's, if you have Hashis, if you have CIRS, if you have apnea, if you have anything that raises cytokines, you're going to have more predisposition to having mood experiences that are not a spiritual crisis, that are not a personality disorder.
Hmm.
They are corrupted biochemistry, and your immune system is dysregulated, overzealous, and going bananas, and it lands in all tissues. And that's why we tell people cytokines do not need a passport. They will go across every border into every system, your tissue space, your joint
They
space.
don't discriminate.
They don't discriminate in that, and that swelling, that puffiness. You were like skinny puffy, and we see that all the time, right? And inflammation is rubor, calor, dolor,
Oh,
tumor.
it's
It's red, it's hot, it's swollen, it's painful, but it's a weird. You're like a balloon popping from the
yeah.
inside out, you know,
Yeah.
and
Oh,
that's
it's so
before you
true.
get into the weight loss resistance inflammatory
Hmm.
weight. I always say you're not fat, you're inflamed. Right.
Hmm.
And you're literally eating cleaner than I do. You work out way more than I do, and you're not losing weight for our weight loss resistance people, you know. So you kind of you get the ball rolling, you light the wick, hubby goes, wait a second. Thank God for this Shoemaker guy because he speaks my language, objective, data driven studies. We
Right.
can talk more about what's special about Dr. Shoemaker. It's basically honesty. But and then you do an ERMI, you get the labs, you confirm the labs. What happens next?
So the functional doctor I was working with, I had brought to him Shoemaker protocol, and it all made sense to me. Again, the data was there, and at this point, everything up to this point, it was like a shot in the dark. Because even when all these things I had come to know with a diagnosis, I'm going, wait a minute, these are all a label slapped on a symptom, and we understand as a diagnosis. And it was almost like everything I had understood up to that point, I was like, I've been lied to. And maybe not intentionally, but I think once you make sense of it, it's really pretty simple. Um, but I took everything to him, and I'm like, here's Shoemaker protocol. Makes sense to me. Here's my genetics. Here's or my HLA, here's my labs. And we went through that. He confirms, yeah, you've got chronic inflammatory response syndrome. We can treat it with this protocol. And so, no, you don't need CSM. I work with people all the time, and I can get them better with all these different binders and herbals and, the kind of typical mold protocol route. And I thought, okay,
Typical false, misguided,
hundred
not
percent,
proven, not published, not
100%.
peer-reviewed, meaning I'm a peer that didn't get to review their work before they perpetrate the chronically ill patient's time, money, and energy.
100%.
Yeah.
Yeah. And I think one of the biggest issues, and I know you'll agree, but so many providers and physicians out there, they're not sitting down and doing the research and looking at all the data. They're just like, oh, that my peer over here, that's the protocol they've been using. That's kind of the gold standard. So that's the one I'm going to go with too. But there's no data to back it up. And, but I was so desperate, and that was immediate to me. So I'm like, okay, you know
And
what?
they,
Because he
they,
couldn't,
they sell you on it, right? You're like, oh,
yeah,
I guess there's probably alternatives.
yeah.
You don't have all day to,
I was
look
I
into
was
every
ready to
single
go,
thing.
like,
In the loony bin.
I was done. So
Yeah.
I'm like, give me something. And he couldn't prescribe. So I thought, well, who knows how long it's going to take me to find someone who can like get me on CSM. Um, so, but pretty quick, I would say, a week goes by, a couple of weeks go by, and I was just getting worse. I'm like, I'm taking all these different things. I'm taking glutathione, I'm taking activated charcoal, I'm taking all these other binders, and I felt awful, terrible. And it was kind of in that time frame. It was funny. I feel like my husband and I kind of flip-flopped because he was the one that was like, babe, you need CSM. Like you need the Shoemaker protocol. And I'm like, it's fine. It's fine. I'll give it a try. And so, but he kept on like, I really think you need to go this route. And so then it was, I think it was around that time actually that maybe he heard your podcast, because I remember him coming home and like, you got to listen to this. You've got to listen to this. And then I was like, okay, I'm ready to go stand in traffic. So I need to make
I
the
don't mean to
change
laugh.
here.
I haven't heard that one yet. I've heard a lot, but
I remember my first kind of my 10-minute call with you. And I think I remember saying to you, I don't feel like I have like a week, a month of, whatever. I'm ready to go stand in traffic and just, I'm done. I'm done. So, and that's when, I made the jump into the Shoemaker protocol, because I was like, what do I have to lose? Like, there's data here. The data makes sense. The protocol makes sense. And, I feel like I had exhausted all other options. And, so yeah, once I started down the Shoemaker protocol, it was not immediate, which is hard when you're so bad off. You want to see that progress to give you hope. And when you don't have hope, it's a pretty dark world. But I was patient, and I, was like, I'm going to trust the science here. And within 2 months, it took 2 months. I'd have good days for sure, but then it could be the very next day was so bad. So it's not linear. And that's what I tell all my clients is like, you're not going to start a protocol and it's just like on the up. It's going to be very rocky for a time being. And not for everyone's journey is different, but it took 2 months for me. And I can remember the day where it felt so different. And the best way to explain it was that I felt like the clouds were parting, like the sun was coming out again. And my life didn't feel so dark and heavy and dull. Like I didn't want to just like go kill myself.
Yep.
I mean, it was like, this is feeling lighter. It feels like life, there might be something here. There might be some joy. My pain started to improve. I was noticing inflammation coming down significantly. I mean, within my face, if you look at pictures of my face when I was in exposure versus now, I look like a different person. I, lived with interstitial cystitis since my early 20s pretty severely and gone, like just
Amazing.
gone, because I'm like, well, ADH, osmolality. And when I work with people and we're looking at labs, it's really validating because you can look at all those biomarkers and, it's like people have all these symptoms and they feel like they're crazy. And when you can say, okay, well, here's your biomarkers and this is why you're having this symptom. And it's like, there's an answer for that. Like you can correlate that to
so validating. Yeah.
my blood work.
The root of doctor is docere, and it means to teach. Doesn't mean to heal. I can teach you how to heal, right? I can't heal you. I can teach you how to heal. And what's so wild about you, Lauren, is you teach this better than doctors. And we run the academic peer-reviewed conference, CIRSX, our annual conference to present new research, and coaches and lawyers and patients and doctors and environmental professionals, inspectors and remediators who are the true heroes. If you can get a freaking incredible inspector and remediator, that is the number one healer on a CIRS case, right? But we will roll out the red carpet to teach any doctor this. I invite them to shout out the clinic. We invite them to come to the conference. We invite them to do the proficiency partners. As you know, Dr. McMahon and I are now writing a spoon feeding course for providers. And then they don't teach that. So the amount of times I inherit like a funk med doc who knows of Dr. Shoemaker, they think he's too gruff. He demands excellence, right? He's
Mm-hmm.
old school Duke University trained medical doctor, and he's going to make sure you are working your ass off for the chronically ill. He's not going to be polite about it. And I don't care. I go old school. I'm not looking for him to coodle me. I want to know what
Yeah.
I'm doing for Lauren on Monday morning, right?
Yeah.
And we can roll out the red carpet, and we inherit those labs. The low ADH is there, the low MSH is there, the flagrant MMP9 that gives MS like symptoms is there, and you're doing a more clear job and spending the time teaching the illness. And my frustration is trying to figure out, where did that doctor take the wrong road?
Mm-hmm.
And that's the most upsetting part. Like, it's fun to be busy at first, and then all of a sudden you're like, 24% of the world's population has the HLA, the genetic predisposition for this illness, and at least 50% of all American buildings are water damaged per EPA calculations. That is going to be 2 billion patients.
Buckle up.
And we're
Mm-hmm.
like one of 5 clinics doing this stuff in earnest,
Yeah.
not bait and switching and adulterating the Shoemaker protocol. And that's why I think the health coach is the future of doing this, because we can diagnose, and then you can really support and hold and clarify the education for the most complex. For the low lying, for the CIRS people who aren't, having MS-like symptoms and all that stuff, it's like, I think we can really downstream this to,
Mm-hmm.
takes a lot of time and a lot of clarity. And why does your husband, and why do you know how to challenge, the status quo and integrated natural funk holistic medicine? And the functional medicine doctor or the medical doctor, the PA or the MP or the ND is not doing that.
Right.
You had
They're
to
not.
pass organic chemistry. You should know how to read medical literature. I do organic chemistry. These doctors are doing alchemy. They're trying to turn freaking activated charcoal into cholestyramine.
Mm-hmm.
They're trying to turn zeolite, the exact opposite charge,
Yeah.
into cholestyramine. And then they're using these well-marketed supplement companies that have no peer-reviewed data.
Yeah.
And the way Dr. Shoemaker proved cholestyramine well call is he did the inflammatory cytokines. He gave them the medicine, which requires 4,200 milligrams of EPA DHA fish oil to prime, to tame your immune system. Say, we're going to calm this immune system, so when biotoxins
Calm
are
it
going to
down.
the toilet,
Mm-hmm.
we don't spaz out, right? And you're coming up with some new ideas on that too that we're going to put to the test, and everyone's open and willing to test that. But then MMP9 and C4A and TGF beta came down on that prescriptive binder. I'm the naturopath. I want the natural binder
Yeah,
to work.
right.
And we've tried them all,
Yeah.
right? Chitosan looks the most like cholestyramine from an organic chemistry perspective, but stomach acid breaks it down before it gets to the small
pH.
intestine. Yeah.
Yeah.
So it just kills it. So you said your story is so insane, but I always tell our patients, you're not getting that much older, you're getting more inflamed.
Yeah.
You're just like, I always think of Lady Gaga, the poker face, my puffy face, my puffy face. Yeah, that's CIRS, right? It's like,
What it felt
it's
like. I was like,
yes,
there wasn't enough. I'm sticking my face in a bowl of ice water every morning. I'm like, why? I just didn't look
yes,
like me. I didn't feel like me.
yes.
That
But
inflammation.
before I forget that, you were about to go teach and introduce a bunch of providers, Funk Med, PAs, NDs, MDs, CIRS.
Mm-hmm.
And then you broke your back.
And then I broke my back. I did. Yeah.
Oh, I was so excited. You had like an army of potential providers you were going to
It's
teach.
next week. I'm doing it
Oh,
next
yay,
week. So
yay.
it's
Good.
still happening. It got postponed because yes, if you have seen the pretty intense video of my body bending in half, I did. I fell off the zip line. And I landed on my upper like back, but instantly I felt the blow hit my lower back. It was instant. And I'm really, really lucky. I did not break my neck. I didn't die, and I'm not paralyzed. But, the first, maybe not the first thing, but the second thing that came to my mind as soon as I hit the ground, and probably even before I hit the ground, was just like, what the hell is this going to do for my CIRS journey? Because I had
Mm.
come so far, and just knowing the amount of trauma to my body, the inflammation, the healing process, just all of it. How is that going to set me back? So, um, it's pretty wild, because once you've been through CIRS, you've, come out, you've been in the dark places of it, you've come out on the other side of it. You have a new perspective on life. You just do. It feels like you're seeing life through a different lens, because you're not living in, the mental state of suicidal ideations and depression and chronic pain. My pain, I still can't get over how bad my pain was on a daily basis when I was living with CIRS. But with all that said, it was just this new perspective. And yes, I broke my back, but even in the ambulance ride, on the way, and they're pumping me full of just trying to calm my pain down, all I could really think was, this is no big deal. Like, this is totally fine. Like, I don't know what's going on here, whatever it is, like, I can handle it because I've been through CIRS. Like,
Wow.
that was the worst of the worst. And this felt like a physical, tangible, I can do that. That would not have been my mindset without CIRS. So it just totally shifted my perspective after coming through CIRS, and then after nearly breaking my back and avoiding death. You kind of have a different perspective there as well. So it almost feels like I was given two really huge gifts in a really short period of time.
I think we've talked about this on the phone, but the other thing you get from that, right, is a deeper compassion for everything in the world.
Mm-hmm.
And if compassion means understanding, you're no longer going to judge that person who's 200 pounds overweight in the bank line in front of you, because you realize that's corrupted biochemistry. They could be eating cleaner than I do and have raging apnea in a moldy building, while not being educated on seed oils. And
Yeah, you almost want to tap them on the shoulder.
I do. My wife's like, stop that. We don't have time for you to tell
Right.
them go do a VCS and do clustered symptoms,
Yeah.
and screen for
Yeah.
CIRS. And I think the other thing we talked about is, I'd rather be like morbidly obese with a brain that works at my high school reunion than fit and suicidal ideations,
Yeah.
depersonalizing with neuroinflammation, wanting to put a block in my mouth. And I think that's of all the symptoms, and the dermatological are way understated. If you have a
Oh
skin
my
rash or
gosh.
weird stuff that's not being explained, it's one of three things. It's inflammation, it's congested liver that what the liver can't handle knocks on the door of the skin and
Yeah.
says, help me detox this, or it's actual topical overcolonization with things like P. acnes,
Mm-hmm.
actinobacteria, or all the above, right? And you figure that out. You're on this incredible healing journey. You're starting to tell the world your story. CSM 2 months in, you get that first lift of, oh my gosh, there's nothing wrong with my personality or my spirit. I was just brain on fire.
Yeah.
What happens then? You start telling your story, and moms and all kinds of people are like, tell me
Yeah.
more.
Yeah. So, I would say I didn't start really sharing. I knew even long before, figuring things out. I just had this intense desire to, like, one day I will use this. I don't know what that looks like,
Mhm.
but one day I'm going to use this. Once I uncovered CIRS, once I'm walking through everything, and the more I was continuing to learn and understand, because I just couldn't stop. I was like, the more I listened to, the next thing that I heard blew my mind. I'm like, I have to know more. And the more that I started to understand and gather, I'm like, how is no one talking about this? And of course, people are, yourself and so many others, but it's not, they're not on a large platform where,
It's at a whisper level, and it needs to
yeah,
be with
it needs to
asbestos.
be
It needs to be with
screamed. I mean,
radon. It needs to be with lead pipes. It needs to get
Yeah.
the public awareness, public health, and it needs to get into naturopathic and conventional medical training. So
100%.
so
Yeah.
people know, oh my gosh, this reeks of CIRS.
Yeah.
I'm going to
It's
do a visual contrast sensitivity and clustered symptoms and consider if we
boom.
should do the
Yeah.
labs here. Yeah.
Right.
Yeah.
And, so anyway, I just thought other people have to know this. Like, I just have to
Mhm.
share. I can't go day to day everywhere I go, kind of seeing it. And it was like, it was just keeping my nervous system in a wreck. And so it wasn't until, I started CSM, like May, I think, and I started sharing our story in around August. So there was some time in there where I'm like, how am I going to do this? What am I going to do? I don't even know what that looks like. And yeah, so one day I made a reel, and I had, just, I don't know, like 600 followers of friends, family, and whatnot. But I shared, and it just blew up, like totally unexpected. And the more I continued to share, the more the response was completely unexpected. And I still don't really know why me. There's other people out there doing this and have the same passion that I do and desire to bring this to the masses. But my account just really took off. People resonated, and I've always been that person that can strike up a conversation with someone in a grocery store, and they're going to tell me their life story. It just
Mhm.
anywhere I go. But
Mhm.
people, really started flooding into my DMs and having questions, wanting more answers. And so I just used that to start educating. And it was like, I don't know that I'm ready for this. I'm not really healed. I'm still very much working through it. Um, but I had many conversations with God, and a lot of those had a lot of choice words in them because I was angry.
Mhm.
And, it was very adamant to me that he's like, well, this is what you wanted. Like, I'm making it happen. So I'm like, I have to run with it. And that is what I have been doing ever since. People were reaching out. I was working about 12 to 16-hour days without for free, just for free. I want to help as many people as I can. And then I had people like, I'm busy, I'm sorry I can't, maybe let's 2 weeks out. They're like, I'll pay you if you can see me sooner. And it just, that continued to progress to where it turned into a consulting, business, really, where I was taking paid clients and then going through, Shoemaker proficiency partner and doing coaching, so with a lot of CIRS patients. So everything just kind of evolved without having a plan in place. And
Yeah.
I feel like I say all the time behind the scenes, it's like fake it till you make it, because it blew up before I was ready for it to blow up. And
Mhm.
there's still a lot of catching up that I'm doing, but so much good has come from it. Overwhelming, an overwhelming amount of good.
Well, and
Um,
I don't like that phrase "fake it till you make it" for you, because I have stockbroker friends who said that in New York City, and it's like, for you, I think the reason it blew up, it is God's plan, but it's also you're personable. You can educate in basic terms. You don't speak over people. You come from the heart, but most importantly, you offer clear, clean, honest support. And I think, and you do it consistently, right?
thank
Like
you.
you really try and give back to people. You
Hmm.
really try and show up. And I think that was a missing niche, right?
Hmm.
It's like in this world, I mean, every post I do is peer reviewed and published and based in facts, but you have to we have to add up all these whispers and make it into a megaphone. And I think
Yeah.
you have a real organic sincerity and purity to your education, your intention. And if I get to sit down with God, I tell patients this often. My first question would probably be like, "What's up with pediatric cancer?" Like, that's lame. And then my second one is, why did the Dorninger tribe get access to the right information
Yes.
and the right direction.
Yeah.
And all these people are not. And
Right.
again, I have had shysters, shenanigans, charlatans in my house. People screwed me up with dry citrus fog. You never want to use a biocidal fog in your house, meaning anything that ruptures cell
Hmm.
wall fragments, right? We were talking earlier about this is a microbe, right? And it's not good for you, but when you do bleach or Thymol or citrus fog, you'll turn it into ruptured cell wall fragments. And these are hundreds of times more stimulating to your immune system. So if someone's like, just fog it, what'll happen is they'll show you a mold plate with growth, and then they'll show you a mold plate without growth. And that's because there's no more live cells. All those dead cell wall fragments that still show up on a qPCR, on a ERMI, are literally flaring you. And we've had so many people do that. And the reason I share that is I did that.
Hmm.
So, and I have bitterness around that. And I am working on forgiveness because they knew Dr. Shoemaker's work. Right. And they knew the environmental professionals at CIRSX. We try and combine the healthcare providers and the coaches and the patients with the environmental professionals at our conference, because I need to know about the building and they need to know the
Have
basics.
to bridge that gap.
You
There.
have to
Yep.
bridge that gap. And where I think we connected is you're really trying to provide access on a larger scale and then more one-on-one for support, because on paper, the Shoemaker protocols, easy peasy lemon squeezy.
Yeah.
Then you get to step one, remove patient from biotoxic exposure. Then you get to a potentially constipating cholestyramine, well called cholestyramine. And that's where functional medicine should come in. How do I support your motility? How do I complement the Shoemaker protocol?
Hmm.
Right. So I just think we bonded over access and the desire
Hmm.
to deliver clear, peer reviewed, reproducible, pure, honest
Yeah.
healing, because this is a vicious yet treatable illness. And when you tell me, like, kind of took a year to get to Dr. Shoemaker's work, like, we're seeing people at 17 years and $300,000 in.
Yeah.
And now there's no money left to fix a crawl
Yeah.
space. Right.
Oh, it's true.
So,
That's the majority. I mean, everybody, pretty consistently, everybody, unless they kind of find me first. But, people have been chasing mold for years, or if mold's
totally.
not on their radar, they've been dealing with chronic illness for years. All these, chronic fatigue, fibromyalgia, POTS, just the list goes on. But just as you said, why did the Dorninger family find, all the kind of the right information? That's how I feel as well, because
Yeah.
it didn't take me. We were in this house for 5 years, and I was dealing with symptoms that entire time, but it was the last year where I was really struggling. And I would say, even when mold was kind of on my radar, it was right in between that, like, MS, mold, CIRS. It was like really compounded. And I came across that information very early on in our mold journey, where I could have discovered mold. I could have started this protocol that my functional doctor put me on. And we both know I would be nowhere in years. Like, my symptoms would probably continue to get worse. I'd develop more autoimmune issues. And so often it's like, yeah, why me? Why did I land on this
Yeah.
information so early on where others don't? And that was part of my urge to share, was like, people need this information earlier on in their journey. So before they're beginning remediation, they can understand where we need to fit the puzzle pieces together. It's not just your health on one side and the remediation aspect on the other side. It's how those two fit together. And when you're not putting those puzzle pieces together, there are so many cracks in between that if you don't do everything the right way with all the right information, you're either going to be out thousands of dollars down the line, or like your mental health and your physical well-being is also going to be down the toilet, because you're not understanding how it all fits together. People are thinking mold. One of the biggest things I try to educate on is it's not just mold. Mold is just one biotoxin of many Little did I know when we came across this, I'm like, great, it's mold. And my husband's like, you've got to be kidding me. Like, we're just wrapping our mind around MS, and now you want to like explore mold. And the number of fights we got in was, people think it's good now, but it was hard. And but it's so yeah, kind of wrapping our minds around, okay, now we're gonna look down mold. And I thought, wouldn't you rather it be mold than MS? Like, right? Because then I can we'll just clean the house, like we'll fix it and life will go back to normal. I had no idea the biotoxin door that I was like walking
The
into.
onslaught of the Lord of the Rings of CIRS. Yeah. No, you're just battling the works, right?
No, it's
no, that doesn't mean it's not treatable. I get so many people in my DMs too who I'm like, I don't know who's telling you this is like some lifetime thing you got to deal with. This is a vicious, violent yet treatable illness.
Yeah.
And no one's taking you through the steps. And the steps are a pain in the keister, but they work.
They
right?
work.
So I have to tell you two things about what you just said. So my experience to this, I'm in private practice 2003, and the first 10 years we're crushing it with a lot of things, autoimmunity, and I'm understanding immune tolerance and fat soluble vitamins and seed oils out, and I called them omega-6 inflammatory fats. I didn't realize you got to call them seed oils for them to get popularized, right? But this is like I've been preaching get linoleic acid, omega-6, arachidonic acid producing oils out for 25 years. But then boom, seed oils. That's what we need to do with CIRS, right? We just need to make it, this person's got multi-system, multi-symptom illness. They got many symptoms and many body systems.
Right.
I'm a chiro, I'm a neurology nurse, I'm a neurologist, I'm a acupuncturist, I'm a PA, I'm a health coach. I got to do a VCS and cluster symptoms. We can talk about that, right? But 2013, Boulder gets hit with a flood of 16 inches of rain in 7 days. That is one annual rainfall, 1 year of annual rainfall in a week. And the streets form in the rivers, and the college kids are biking through these rivers, having fun. And then all of a sudden, the clear water goes brown water, and there's so much flooding. The sewers pop. The manhole covers are literally coming up, right? And patients who are getting better with me got worse. Patients who never got better with me got worse. And they were driving me crazy because I want to show up for my patients and get results, or at least teach you how to heal.
Just to clarify, this is before you had CIRS on your radar.
100%. Yes, it's fall 2013. And I have this lovely but kind of eccentric crazy phlebotomist named Cheryl. We were good buddies, but I had to like get back to patient care, and she would chat me up about, EMFs and crystal healing and, some stuff that's a little bit out there. And then she hands me Mold Warriors, Dr. Shoemaker's work. And I'm like, oh, whatever. And I throw it on the back shelf, and it sits there for like 6 months. And then I'm like, wait, water damage, could a semi-arid desert have mold? Of course it can. So we always tell patients mold spores are in the Mojave Desert. You need two things to get amplification and create health problems. You need mold food, which is cellulose and paper and pulp. It's the good-looking piece of junk American home. We literally build the Three Little Pig stories.
Organic material.
It's that organic material, and that's why the yuppie hippie who built the straw bale house, they're screwed, right? And then the next thing you need is water. And that can be from high humidity in a Texas crawl space, right? It can definitely be from 16 inches of rain.
Yep.
So I read the first 2 chapters, and I'm like entering this world of like, whoa. Driving home, I call my wife. I'm like, I'm not making home dinner. This book's in my head. I'm going to pull over this random Starbucks, get my peppermint tea like back at Bastille, and I read chapter 3. And chapter 3 is the biochemistry. It's the original version of the biotoxin pathway. And I read about UBOs, unidentified bright objects on brain MRIs. And I've been seeing UBOs forever. And what that means is you have white matter lesions, unidentified bright objects, not in the region of multiple sclerosis. If you have classic MS, you have these ventricles in your brain, and you have these white matter lesions around the ventricle. They're called periventricular white matter lesions, right? And that's pathognomonic or classic MS brain MRI. So if you have these UBOs, you'll have MSE symptoms, but they can't put you in that box. It doesn't fit, right? And holla, that's your story. So then they say secondary to ischemic vessel disease, which means you must have these clogged carotids that don't feed the brain with blood flow. But I'm one of the kings of preventing heart attack and stroke. So I already have a carotid ultrasound and a heart scan on these patients, and there's no carotid plaque. And I go, oh my gosh, for like 10 years, I've been looking at unidentified bright objects, UBOs, that are most likely CIRS. And they've all been CIRS, right? And then you have to challenge, well, what does MS mean? Many sclerosis scarring from an autoimmune attack in your white matter. Is that a diagnosis in my clinic? No, that's what you have. Why do you have autoimmune attack in your white matter? Right. And that's where the journey of true diagnosis begins, where it should be a 3 to 5 page exquisite explanation of why you have, and that's why I think God wants you to do this work, because you're trustworthy. And you might, I would say, like, once in a blue moon, you ask me these high level astute questions on super complex CIRS cases, right? The other, like 90%, if you read medical literature honestly, you should get them the first or second time, especially as a healthcare provider. Like, it's not the discovery. Dr. Shoemaker's discovery was rocket science. He's a bona fide genius. And I'm smart. I hang out with a lot of smart people. I'm not a genius. I'm a good soldier. I know how to educate. I know how to stay honest in differential diagnosis. Dr. Shoemaker's a freaking genius. But so the discovery was genius. The application, the understanding, the screening, the confirmatory lab, everything else is more like, do you have blue collar integrity? And so on and so forth. So I wanted to make sure for your listeners, the two things I tell people, I want there to be hundreds and hundreds of medical doctors, NPs, NDs, PAs who understand the Shoemaker protocol, know how to run it, pair up with a health coach, because they don't have the time in their half-hour visit, their hour visit, to go through every hand-holding moment in this illness. And I know you don't have all the time. So now you're hiring these teams of coaches. And the most important thing you are is you're like my CEI, or my Chief Executive of Integrity. Right. And you're just going to make sure that secret sauce of sincerity and honesty and integrity gets translated through your coaching team. Right. But when you're working with a doctor, you ask them two questions before you work with them. Are you in the strict accordance of the Shoemaker protocol? And if they don't know what that means, you say, what kind of binder do you use? Right. Do you get down and dirty with the buildings? If your doctor doesn't know anything about building envelopes, not your doctor. They need to know about building envelopes on a basic level. They don't need to be a general contractor, but they need to understand airflow and how walls should be built, and that gutter shouldn't run next to foundational walls, and yada, yada, yada. And if they're not, walk away. IV ozone doesn't treat CIRS, right? Azoles don't treat CIRS.
No.
And we're gonna talk about that.
Yeah.
But I think that the one of the best things you do for society is you just say, that's not the peer-reviewed, reproducible, published, honest screening, confirmatory labs, and treatment plan for this illness.
It's true. Yeah. And kind of just to add to your point of finding the right provider and doctor to work with, I can't tell you how often I work with clients who come to me and they have had labs run previously. So they've either had, but they don't know how to interpret or make sense of any of those labs. And we're looking at them, and sometimes they've even had the HLA, HLA-DR 1345 and all of that taken. And I'm like, has anyone ever gone over this with you? Has anyone explained this to you? And they're like, no, or my provider just said that I just have a more difficult time detoxing mold. Well, no, you're 4353 or 11352B, and there's a lot more we need to take into consideration. Have you ever been tested for Lyme? Or they've had you strictly, working on mold, getting out of mold, but did they ever put actinobacteria on your radar? Did they ever talk to you about endotoxins? Did they help you understand the small particle clean aspect of a remediation remediation. The remediation is not just removing the mold and replacing. There's so much more to it that if all those things aren't understood, I mean, it just keeps people in this vicious loop they can't get out of.
The
So
amount
there,
of the amount of normal hurts me too. So just on that, from water damage building mold perspective, the only peer-reviewed published paper that correlates statistical likelihood you're going to heal in that building from mold is the Hurts Me Too, right? And the Hurts Me Too is the 5 most immune reactive molds pulled from the ERMI.
right.
And that stands for health effect, roster, type, species, mycotoxins, and inflammagens too. But it's Dr. Shoemaker's humor that says it hurts me too, which will be one of our shirts at CIRSX, right? But him and David Lark, who's just this esteemed mycologist out of Australia, they presented that paper in Europe. So what I tell my patients to say to the inspector is, please don't play doctor in my house. Please don't tell me, Mrs. Smith, this house is clear. I air sampled it. You should say, what level of air sample has been peer reviewed and published to statistically show me the likelihood? What level of mold plate? Now, can a mold plate feel emotional and show a husband, look, there's fuzzy things growing here? But you have no idea if that cleared the statistical likelihood for you to heal in that house from mold. But then these people will bring in hurts me twos of 4 or 8s, should be less than 10 for statistical likelihood for CIRS water damage building mold. And I know I'm preaching to the choir, but they're still sick. And then the endotoxin comes in, which should be less than 500 at less than 100 at 500. And even if it's like a 97, I'm doing skeptical hippo eyes on that, making them get a plumber smoke test. And we find the sewer leak or the kitty litter box,
I have to tell you, I just saw an endotoxin score the other day of 1100. I don't know have you ever seen one that high?
Well, Aaron Pettigrew, who's one of the 3 gentlemen, myself included, that talk about our suicidal ideations that were gone after treating CIRS on episode 8 of the Vitality Hour.
Yes, yeah.
We talk about regrowing his brain, and he was getting gassed by the kitty litter box next to the HVAC, right? And I present his case openly. Aaron signed his life away to say, I just want the world to know about this.
No, it's a great story.
Aaron's like you, like he's pure and he wants the world to have access and he's a no nonsense guy. But his endotoxins were 20,000 on one floor and 10,000 on the other floor. And that's the highest I've ever seen. So 1,100, just to not downplay what you just said, that is cooking with gas.
It is.
But it gets even crazier.
Yeah.
So he had cortical atrophy. If you cut a Twinkie in half, the outer casing of his brain was shrinking. Hippocampal atrophy, where dementia Alzheimer's hits, and 2 other nuclear atrophy as a 39-year-old. He's losing his mind, worried about losing his job, snickety on his wife, and he's a sweetie pie grizzly bear of a kind man, and like getting snickety on the kids and getting all like agitated. Treat his CIRS, and he's so good at saying, get the house right. It's worth every penny, but you have to have the right coach, the right inspector, the right remediator, the right healthcare provider. Then he regrew his brain, and we regrew 3.5 of his 4 atrophic nuclei. And for 40-year-olds, you're averaging about 1 to 1.5 atrophy. So his brain is now bigger and more plump and more capable than healthy age match controls. So it's freaking awesome. And that's so, like, I never thought as a scientist and a doctor, I could say we regrow brains literally on pre and post brain. Like, I'm not muscle testing you going like, bro, your brain's better. It's like we literally have objective data, but measurable. But most importantly, I wouldn't care if we had that and he didn't feel better. And he is back, like back, right?
Yeah.
And he went from 34 cluster symptoms to 14 to 4 to 1. And per the conversation we had yesterday, he said, this last little bit of fatigue, I'm not going to get over it until I get in the gym again. And I know that. This isn't CIRS. This is me needing to go do resistance training again. But the exercise intolerance was so intense. And like you, he likes working out. It's not a chore, it's a joy. And he likes building lean muscle mass, and he likes the antidepressant and anxiety lift. But he was crippled from going to the gym because of the
it's brutal. It's like that's your mental outlet, and then it gets stripped from you because of CIRS. And
So I wanted to make sure we covered some of the most. We talked about, shoddy inspectors and
Yeah.
people who the environmental professionals don't read, keep up with the literature either. For anyone environmental, CIRSX, you go to CIRSX and CIRSX Institute has the medically important remediation course and the medically important assessment course, which
Yep.
was written by John Banta, Greg Weatherman, Cindy Edwards, Michael Schranz, and Bill Weber, some of the best in the business. And what was the best about that course is they all argued to get to consensus and what the science says, right? Like an air scrubber isn't enough in a workspace. It
Hmm.
helps. But when you're done with that workspace, we were talking about how you need to use Aerosolver, and there's a DIY way to do that. But an Aerosolver is a non-toxic, non-biocidal fog. It doesn't kill anything.
Hmm.
The idea is taken from the asbestos industry, where it settles, right? And even if you vacuum all your walls and wipe down everything, there's still little cell fragments and microbial in the air, right? So you aerosolver, and then you have to damp wipe it with
Yep.
microfiber cloths and either isopropyl alcohol, vodka, or Everclear. If you don't have boundaries on alcohol, I say use the vodka. And if you're really getting burned out, put on a good podcast, take a shot, and keep cleaning meticulously. Don't take 3 shots because you'll miss
Yeah.
areas, right? So we want to make sure you're like vetting everybody and everything from the beginning. And Greg Weatherman has a really intense statement. He says, do it right the first time, which was my Austrian work ethic dad, or the last time. I hate
Yeah.
that because it's so painfully true.
But it
Right?
is. It
But
is.
some people
Yeah.
get to our clinic and it's their 6th round of doing this.
Right.
And the husband's like this. And if they're an engine nerd, I
Hmm.
got them because I'm like, I speak your language.
Yeah.
I'm
You're
going to
like,
show
hold
you
on,
peer
hold on.
reviewed,
I'm going to blow
reproducible.
your mind.
Yes,
Yeah.
totally. Yeah.
Yeah.
So what are the peeps? What are your people like really? What's the biggest myths? What's the biggest mistakes? What's the biggest obstacles we're seeing out there?
Well, there's a number of them for sure. And one that you and I, we've wanted to touch on. And so I think just kind of jump in. Um, azoles, those antifungals that are really, really misunderstood. And I think because there's all these different camps, there's all these different providers, different types of protocols. And it's very, I will say, misleading because there's a lot of videos and good information that supports and makes these antifungals seem like that's working, that's the real deal, that's helping. But there's a lot people don't know and don't understand. So I'll have you kind of touch on that. But leading into that, recently, I had a client who I spoke with, and she's just been through the absolute ringer. And look at her HLA, and we confirm that she's got some multi-susceptible genes and mold susceptibility. And she tells me that she's been through it all kind of with her health and ends up at Mayo Clinic diagnosed with sarcoidosis, but they had her on 3 antifungals like azoles. And then they were also having her actually inject molds to build up immunity. And that's a whole other topic, but the azoles blew my mind. And because I contacted you and it was just like, this is intense. So yeah, if you want to kind of just jump into the azoles in the world of why someone needs to be educated and informed before jumping into that, and kind of what the risks are that come with it.
Yeah. Yeah. So the first thing is to realize with CIRS, there's nothing to kill. You don't need herbal antifungals. You don't need azoles. And if you're doing that, you are totally lost. So is your provider, and you're on the wrong track, period. We are confusing and missing fungal colonization with fungal infection. Everybody has yeast and fungus and bacteria and actinobacteria all over their body.
Right.
You can get exaggerated levels of that with fungal colonization, and that is not CIRS or the cause of your illness. Now, that could be like a small intestinal fungal overgrowth, a SIFO, right? That is usually a product of lack of motility. Something has slowed your guts. It could be a hypothyroid. It could be that you concussed and your vagal bundle doesn't feed your motor enteric complex. It could be you have autoantibodies to your stomach acid making cells called your parietal cells, and you have a low acidic tone in your stomach and intestine. Bacteria and fungus love alkaline. They love an alkaline pH. Your stomach acid is meant to set an acidic tone. Your acid mantle in your dermis is meant to set your pH at 4.5 to 4.9. So fungal colonization is not needing killing. Once in a while, you can on imaging see a giant fungal ball. And if that becomes a airway obstacle, which I've never seen anyone breathe through their sinuses, I see them breathe through their nasal passages. So people use sinus and nasal passages interchangeably. I taught anatomy for 10 years. This is a nasal passage. This is a sinus, right? So it's like common sense, not so common in highly educated people, right? To hear that Mayo did azoles is upsetting, right? But so there's nothing to kill, right? So if it sounds good, it doesn't mean it's true. You need to peer review and really grind out that. So I love Dr. McMahon's approach on this, which is he doesn't get all flustered and angry and bitter. He just says, show me the data. So if these are working so well, you should take CIRS markers, you should apply an antifungal, azole, a ketoconazole, diflucan, fluconazole, itraconazole, and then you should have the patient get all better. What happens is there's mild anti-inflammatory effects while you do major damage with an azole. So you'll feel transiently better, which is that crack pipe you wanted when you were depersonalizing. And you're like, CSM is taking too long. And CSM doesn't take too long. If you get people out of exposure and you explain to them, hey, for mold, this is about 6 to 12 weeks to slowly but surely ramp down your immune responses. And for endotoxin and actino, it can be 3 to 6 months of no exposure in those. So and it's not like it's like at 3 months, the lights come on. Every week you get a little bit better. You go F, D minus, D plus, C minus, C plus.
It's a slow progression. And I think people expect it to be faster, and it's not.
We're Americans. We want it yesterday, and we want it for cheaper, and I'm entitled to get what I want without doing any work.
Right.
And again, that's not a lot of our patients work their tails off, but you know what I mean? That's the culture. And so people think there's something to kill, right? There's a theme out there, kill, bind, sweat. You don't need to sweat. 80 to 90% of detoxification happens from liver, gallbladder, intestine poop. Liver, gallbladder, intestine poop. About 5 to 10% comes through your pores, about 5 to 10% through kidney, bladder. And if you're Oprah and you want to buy 3 saunas, great. I needed that sauna money to fix the crawl space. So you don't have to sweat, but people can feel better. That's step 3 in naturopathic medicine, stimulate the vital force. Step 1 is identify and treat the underlying causes, also known as remove obstacle to cure. You're not going to sauna your crawl space clean. Right. And then a lot of people put their saunas on the basement floor, and we lift up those saunas and they're full of microbial growth. Yeah. And you're like, why was I depersonalizing in the sauna? Oh, I must just be going into a meditative trance. Right. No, you're getting neuroinflamed and your brain is dying. Right. So azoles. So how this all went down. Azoles, ketoconazole, itraconazole, and diflucan, fluconazole, they atrophy the brain. They literally shrink the brain. And we're working to publish the data on this. We have the data. We got to just take the time to write the paper. And how we figured this out is someone in Boulder County, not yours truly, was using antifungals. And what antifungals do is the azoles, A-Z-O-L-E, and there's 3 big ones, itraconazole, ketoconazole, diflucan, fluconazole, right? What azoles do is they do horizontal gene transfer. So when you take them, they work with your bacteria. The antifungal works with the triggers the fungus to work with the bacteria. It stresses out your fungal kill to trade in-house secrets on how to outsmart drugs. So what happened when you took azoles is Marcons, a stubborn staph colonization of the nose that is a biotoxin forming organism. If you're in the cleanest, pristine house and you still have Marcons in your schnoz, you are still in biotoxin exposure. It produces polycyclic ethers, polycyclic esters, which are very neuroinflammatory. They can give you palpitations, but your EKG is normal. They can give you neuropathy, numbness, tingling, all kinds of weird stuff, and then give you chronic fatigue, right? So Marcons, cons is normal, coagulase negative staph. That is on everybody, right? All of these staph bacteria have outsmarted penicillin. I always say penicillin is so 1940s. There's not a penicillin on a staph on the planet, coagulase positive or negative, that doesn't know how to outsmart penicillin. They all outsmart penicillin. What we do in microbiology is we do a coagulase test, and it's coagulase positive or negative. And that's just an enzyme test to sort you're in this group of staph or in this group of staph. Marcon is multiple antibiotic resistant staph bacteria or coagulase negative staph bacteria. And that's when your cons has outsmarted at least penicillin plus one other class of antibiotic. Penicillin and methicillin, penicillin and doxycycline, penicillin and clindamycin. The two heavy hitters that usually kill these staph bacteria are gentamicin and vancomycin. And to be very clear, vanco is the last resort drug we're using in the ICU for someone who has cellulitis and so on and so forth. So doctors who were giving azoles were showing up in their region, were showing up with gentamicin resistant or indeterminate. Indeterminate is you starting to outsmart the drug, the bug starting to outfox the drug, and vancomycin, last resort drug, resistant and indeterminate Marcons. And Dr. Shoemaker had never seen that before. So he sees this. Joe Musto of Microbiology DX goes, we are having gentamicin resistant, vancomycin resistant Marcons. And I've never seen this in the last 15 years we've been doing this together. And they track it to Boulder County. And Dr. Shoemaker calls yours truly as like, why are you using antifungals? And I'm like, you're out of your mind, brother.
Stop yelling at me.
Strictest shoulder. I don't care about why he yells at me. I tell people that all the time. Like, if you are not getting yelled at by your mentor, you're probably not learning enough for the chronically ill. My loyalty is to graduating chronically ill patients, right? I don't need a spiritual mentor, emotional mentor, or a hug. I need to learn how to diagnose these people who don't have access to answers to graduate their illness. So he's yelling at me, which I tell people I've been getting yelled at by Dr. Shoemaker for 11 years, and he's a dear mentor and friend, and I would do anything for that man. And me and my family are sick without him. So are over 2,000 patients who have come through Roots and Branches and gotten answers, right? So he's yelling at me. I'm like, Dr. Shoemaker, I can get my patients to sign a release of records, and you can pull every chart that we have a Marcons on, and you can look at our treatment. We are in the strict accordance of the Shoemaker protocol, right? There's another doctor in my area who still uses azoles, which is absolutely crazy, who was driving gentamicin and or vancomycin resistant Marcons through horizontal gene transfer. I know it's a big word, but just realize when you give an azole, you stress bugs to go, oh my gosh, do you know how to outsmart this? Other drugs, and you create vancomycin and gentamicin resistance. Those people, until we understood endotoxin, had the worst brain atrophy of any CIRS patient. So now we know the worst brain atrophy.
So just to clarify, because for everyone listening, this is all very technical. So I want them to understand. When you are let's say they're treating with antifungals and you're driving that antibiotic resistance, what you're also saying is that is also, so it's not so much the antibiotic resistance that's like super concerning. It is, but the more concerning is that that's also driving brain atrophy, further progressing brain atrophy.
Yes. And now this has been a peer-reviewed presentation. We just have to turn into a medical paper. But when you see Dr. Shoemaker present that, it's GR or GI, gentamicin resistant or gentamicin indeterminate. That is a super last resort antibiotic that's always been working, or it's vancomycin resistant, vancomycin indeterminate. That is our last resort drug. And that is the second most, that group of patients who are on the azoles have the silver medal for the most brain shrinkage. brain atrophy, right? The most now is endotoxin. So the azole users were the gold medal. Now we realize, wow, endotoxin, sewer gas is even worse. But we see people like really compromised cognitively and
Yeah.
neurologically from azole history. Right now, the other thing is if you give a crap about your kids and grandkids or your neighbor's kids, right? If you don't have kids, you are creating antibiotic resistant super staff by giving azoles. So there is one person you're supposed to do that with, someone who has a fungal infection. And to get a fungal infection, you literally culture their blood, and they have a fungal infection like someone would have a bacterial infection and bacterial sepsis. You get fungal
Right.
infection.
Which is not the same as somebody just having mold
colonization.
toxicity.
That's right. Well, not yeah. Well, and mold toxicity means you have dead, inert biotoxins, no mold in you, no mold growing in you.
Because
right?
the misconception is most people thinking I'm affected by mold, I have mold toxicity. First, they're not understanding CIRS, which we're trying to help them do, but they're also, because this is a really big misconception when it comes to the azoles, is that people think I'm colonized, and even if
there's something to kill,
even if there's a colonization of some sort, the treatment is still not antifungals, because
That's
what you're
right.
saying is the difference is there is a fungal infection that is actually within the blood, and that is a true emergency situation that needs treatment with antifungals, and those antifungals should be reserved for that.
And in 20 years of private practice, as a guy who's pulled probably 100 fungal cultures, blood cultures, to see if we're growing out fungal infection, we've had zero. And there was one time in my 30 years of healthcare where we saw this, and it was a shit show, pardon my French, but that was the HIV progressed to AIDS crisis. Before we had good antiretroviral drugs. And what happened is that HIV destroyed the CD4 general of your immune system, so you couldn't coordinate an immune response. And these patients could die of a fungal infection. They could die of a herpes outbreak, right? They could die of a varicella outbreak, right? So this is the deal with those patients. It's appropriate to inpatient them, put them in the hospital, and put them on IV antifungals. But doing that, we atrophied their brain.
Yeah.
Right. So if I could go back in my hot tub time machine, give them a hug and say, hey, I want to see you free, and we're going to get you to VIP and regrow your brain. So for the people who've been ruined by azoles, right, there is hope for you, but you got to get on the right track. And the last step of the Shoemaker protocol can regrow that atrophy. So you have brain shrinkage off this drug that gives you a transient anti-inflammatory effect that you think you're on the right track, right? Rob Peter to pay fricking Paul, right? Number two, you're creating super infections, gentamicin resistant, vancomycin resistant Marcons, right? Number three, you're shutting down the voltage dependent anion channel. And what that means, it's a fancy term for the tunnel between your cell jelly and your mitochondrial fire pit. And if you feel passion intensity, I mean, it's like, yeah, because you're freaking killing the patient's chance at getting better.
Yeah.
So what's supposed to happen is I'm running on ketones or glucose, and I need to get that glucose log or that ketone log into the mitochondrial fire pit. Let's use glucose. I rip 8 ATP in the cell jelly, the cytosol. Then I split that glucose log into 2 pyruvate. Those are 3 carbon logs. And I put those two 3 carbon logs into the mitochondrial fire pit. And in the presence of an oxygen bellow, I don't have apnea, I don't have low VEGF from CIRS, I don't have anemia, I don't have chronic bronchitis from cigarette smoking. I get oxygen in the cell. I burn that glucose log in the presence of an oxygen bellow in the mitochondrial fire pit, and I make 33 to 35 units of ATP, cash money, chi, life force, prana. Yes, I'm feeling better.
So much better, right?
So much better. Yeah. Biotoxins and ribotoxins block that tunnel. They're like an avalanche of rubble. So any biotoxins, dead, inert, nothing to kill, mycotoxins, cyanotoxins from algae blooms, ciguatoxin from seafood toxins, endotoxins from sewer gas, etc., they can block that. Azoles also shut down that tunnel so that you can't make aerobic respiration, the creation of energy in the presence of oxygen. 33 to 35 units of ATP chi, no lactic acid metabolic waste product, heavy legs and headaches and all that stuff. So instead what you do is you then make only 8 units of energy while being on azoles plus lactic acid. So you make a quarter of the energy, you go into chronic fatigue from azoles, and then you build up lactic acid and feel heavy-legged and metabolic acidosis syndromes. This is in my CIRSX 2022 Actino study. I show the paper of John Hopkins owns the patent, the intellectual property patent on itraconazole, an antifungal azole, as a chemotherapeutic agent. So they own the intellectual property to use itraconazole to be a chemo agent, right? Because you're trying to starve the cancer cell from making energy. Well, guess what other cells you're starving? Your own. How do you feel on chemo? Hey, I hope the cancer dies before I do. Right. The purpose of chemo is to kill the cancer, hopefully before you kill the patient. Right. Chemo's gotten better, but when you own a patent for an azole, that actually, and I'll Instagram post that sometime in the next couple of weeks just to show you that paper. It is a hardcore, and it's like John Hopkins like, we got winner chicken dinner. We got an intellectual property right patent on itraconazole to work at a chemotherapeutic agent, and doctors should go, whoops, I need to rethink my ways.
Yeah.
Right.
Yeah.
So, and we want to publish on this. So if patients want a class action lawsuit, they can do it because I'm over it. Like, if you don't have peer-reviewed, reproducible, published data, and you're just experimenting frivolously on the chronically ill and wasting their time, money, and energy, we will roll out the red carpet at CIRSX to say, no big deal, forgiveness, don't worry about it, let's get you on the right track. I will text you at midnight to go over your cases, right? And you know, I do that, right?
Yeah. I mean, it's an immediate respect when someone is actually like entertaining CIRS, right? You're like, immediately, I will respect you because you're recognizing you don't know everything.
Yes. And challenge everything politely. Your patients are depending on you to do so. And that includes health coaches, and that includes acupuncturists, that includes everybody, right? So I'm glad you brought up the azoles, and people hopefully will listen to that a couple times.
And just to take it away real quick though. So with azoles, antifungals, it's the brain atrophy, but not just that. It's the mitochondrial, like shutting down kind of systems where people see that crash. So they may feel an immediate relief because of that, lowering the inflammation. And then just as the client I had told you about is, you know, she was on so many azoles, but pretty soon after that, within a couple of weeks, she felt like she was dying. She thought she was going to die. So it's kind of that things start to go up and then they crash pretty hard.
That's right. That's right. And you're also doing this. Don't forget you're doing this. So you're doing this and turning into this. And even when you kill Marcons, this is why you need to be on well-called cholestyramine, cholestyramine, because you're going to rupture cell wall fragments at your liver, gallbladder, intestine, poop with the cholestyramine picking up the trash. You need to take that to the toilet. Yes.
Definitely.
Totally. So I think we're going to have a whole nother episode with buildings, right? But you briefly talked about kind of like husband wasn't totally clear on this. Maybe was thinking about buying a boat that year and was like, I'd rather buy a boat than spend $30K on that's not a story, but that's like the story we get, right? Sure. And then you talked about Mike coming on maybe to help out with some of the getting men on board, because a lot of your followers tend to be, as usual, moms leading the charge. I always say patients will lead the revolution for getting CIRS. I will be a sergeant or a general to help organize the data, but they will demand answers for their health, their family's health, their children's health. But what do you do with when you can't get a spouse on board? Because we also see it once in a while the other way, but it's usually the husband like this.
It's true. Yeah.
I've spent $20,000 on functional medicine doctors and gotten nowhere.
they're over it at
They're
that
over
point,
it.
right?
And they're stupid if they aren't pissed. Because if you're putting forth that first, second, third round energy, you're not getting answers for your family
Right.
and your wife. And they're also grieving. They're also really freaking out that they'll never get their wife back.
Oh
Right.
my
So
gosh. I
so
mean,
anger is always topical to grief.
definitely. Definitely. Your burnout. I mean, maybe like you said, it seems to be majority of the time it's the wife, the woman, the mom that's kind of in this situation, and maybe her kids affected as well. And I think so many moms get labeled as like being a hypochondriac, maybe not just for themselves, but their kids. Like you're
Right.
always looking for something. You always think it's something. Um, but I do see there's a number of men who are struggling with it as well, and maybe the the wife isn't as impacted. That's less common. Um, but that is where I try to focus on. There's a lot of stuff I share on my page, on my platform, that tries to connect those dots of this might be why your spouse isn't affected, but you are.
Right.
And this is what you can share with them. This gives
Right.
them that data, that confirmation of, oh, maybe there's actual like concrete data here that they're onto something. They're not just going on a theory. They're not just making it up in their head. And I think that helps people connect the dots where they can be more supportive and they're still questioning it and they're still like over it because financially they're out so much money, whether they've already been chasing mold or they've just been from doctor to doctor and you know, it gets expensive when you're not going the
Yeah.
traditional route. So,
Totally.
but a lot of the time I have clients say, you know, hey, can my husband, can my partner sit in on this? Because you do a really good job of explaining and they don't understand. And I'm like, definitely, like, absolutely. Bring in your whole extended family so we can,
Totally.
because I mean, if you're dealing with it, I bet some of them in the background are too, and they just don't know it.
If we're doing a telehealth in that situation, I tell them we can record the call. And
Yes.
then if we're doing an in person, I say record the call with your
Yeah.
voice memos, right? And I think I'm so glad you said that because females are 3-to-1 autoimmunity to males. And we
Hmm.
think testosterone, we know, is a major
Yes.
anti-inflammatory, immune modulating anabolic cheat code.
Yep.
Hashimoto's is 10 times female to male,
Yep.
right? But I think if a male's testosterone doesn't crash, and many of them do. Mine fortunately didn't during CIRS. I think that and dark chocolate is how it cobbled together a brain to still see patients,
It's a
right?
new protocol. No,
It's a
I'm
new
kidding.
protocol, yes, for sure. The cocoflavonoid protocol.
Yeah.
You don't need the Shoemaker protocol. Just eat chocolate.
Chocolate.
So, but per your point, for our listeners, Dr. Shoemaker looked at 450 healthy people and he defined healthy as they answered yes to 3 symptoms or less in the clustered symptoms.
Right.
He said, let me pull your blood, right? That's how the reference ranges were set. MMP9 less than 332, TGF beta less than 2382, C4A less than 2830. That's healthy controls, right? Then LabCorp puts a bell curve over 10,000 unhealthy Americans and they call the average the reference range. No, you want to have the healthy people's blood be your goal.
Be the range.
Right.
Yeah.
So then for CIRS patients who were 19 or younger, they averaged 19 out of 37 symptoms. What 19-year-old should have 19 healthcare
None.
symptoms?
Yeah.
And
Yeah.
then the older than 19 averaged 25 out of 37 symptoms.
Yeah.
Like you're seeing a 28-year-old with 30 healthcare symptoms, right? And then that in a visual contrast, if you have 8 out of 13 of those clustered groups positive as an adult, as you know, that is a 95% sensitivity for picking up CIRS, right? If you have that with a failed VCS, there's a 98.85% sensitivity for CIRS. And for crisis, Dr. McMahon proved you can use that alone for an alternative diagnosis. So if you have to just give fish oil and well call to Florida hit with a hurricane because everyone's coming with CIRS symptoms, you can do that, right? The reason we still run the labs is because how do I know if I need to correct MMP MMP9 if I don't have a baseline MMP9 as one
Have
of
a
the things.
trackable, yeah.
Have a trackable data, but also because the healthy people never had more than 3 of those original 10 labs, and most had 2 or less. The 5 out of 10 of those symptoms is published, peer reviewed, to confirm CIRS. Larger data sets said 4 out of 10. So for the listeners, if you have failed VCS, HLA, C4A, MMP9, TGF beta, R3 inflammatory cytokines, low MSH, ACTH cortisol mismatch, your brain's not talking to your adrenals right anymore. You don't have adrenal fatigue, you have adrenal hypothalamus pituitary adrenal axis dysregulation, ADH osmolality. And I really appreciate Lauren bringing up the bedwetting kids, because if they don't have a UTI and there's no molestation funny business and your kid's wet in the bed and they're like 5 and they've been long
It's
out
a
of daytime
problem.
diapers, you have to evaluate CIRS,
Yep.
right? Gliadin antibodies and low VEGF or high VEGF. 1/3 had low, 1/3 had high, 1/3 had normal. If you have 5 out of 10, that is like case closed. 4 out of 10 is also confirmatory. And the reason I love that is that's what I explained to the engineering husbands, because the p-values, the statistical likelihood, this is not CIRS, is in the millions. It's a 1 in millions of chance for a wrong. And for the doctors who are doing funky stuff, how are you having the gonads to tell someone to spend $40,000 on a remediation of their crawl space if you don't know you're right? Right.
Yeah.
And
Yeah.
then the last thing I want to make on that, and you're crushing this, is there's CIRS plus. So you can have CIRS and a dental abscess driving your headaches. You can have CIRS and apnea. If you put a violent sleep apnea next to a violent CIRS, there's 90% overlap in the symptoms, right? Because all of your cells need oxygen to function.
Right.
So multi-symptom illness from
Right.
choking out all night, right?
Yeah.
So I know we got to wrap it up, but is there any other thing? I think hitting the azoles, I think hitting the, make sure someone's in the strict accordance to the Shoemaker protocol. Make sure we inspire doctors and allied health professionals and health coaches to please come and support this illness.
Please.
Your handle is at the Toxin Lady, and it's incredible. It's such solid information. That's like, I went
Thank
through,
you.
I was like, is this a real person? Like, does this level of integrity really exist? Because honestly, I am wounded from putting time and energy into providers, and then they bait and switch things.
Yeah.
And then I have a handful of rock stars that I would do anything for because they're doing the honest, peer-reviewed, reproducible, published stuff.
Yeah.
And that's where when I saw what you're doing, I was like, you're trying to create access for all. You're
I'm
cleaning up
trying.
stuff. You're creating clarity, and that saves the chronically ill time, money, and energy. It doesn't mean it's free, but it means the money that could have been there didn't get wasted, and actually all those oars got rowing in the right
Definitely.
graduating direction.
Yeah. Again, if you can connect those dots and put that information together, maybe it's not in the beginning, maybe it is, it's years down the road, but you can see so much progress and you can see healing when someone can explain all of that and make sense of it, that you're not crazy. Maybe you're looking at the wrong exposure, or you've been doing the wrong protocol. You're not understanding, and one thing to kind of dive into or touch on a little bit is I think, misconception or misunderstanding of CSM, cholestyramine, and whether it's damaging mitochondria or stripping the body of cholesterol, those concerns, because it is a cholesterol medication but used off-label legally to treat biotoxin illness. But yeah, I think there's so many people out there who are skeptical to jump on that CSM. I was one of them, and now I try to educate about it. But if you want to touch on that.
Yeah, that's maybe a good closing thought. One of our episodes I do with Dr. Scott McMahon, I go like deep dive into this, but here's like the elevator speech. Welcol, cholestyramine, cholestyramine are all trade names for the same organic chemistry molecule, quaternary ammonium. Dr. Shoemaker had these fishermen who were getting sick off a Pfiesteria outbreak in the Chesapeake Bay in 1996. They all came in with diarrhea, brain fog, fatigue, skin rashes, numbness, tingling, like an explosion in his primary care practice. He said, I don't know what the heck is going on here, but I have something for your diarrhea. He gave them cholestyramine, and they came back and said, Doc, not only is the diarrhea gone, but my memory is back. My depression's gone. My rash is clearing. And he said, what the heck happened? And what happens is cholestyramine, well called cholestyramine, all the same med in different concentrations, come through your mouth and go out your hiney, but they grab biotoxin-laden bile. So your poor liver is working so hard to process these biotoxins out of your body. And what's wonderful about this medicine, it's a miracle drug, is it's ubiquitous for all the biotoxins. It grabs cyanotoxin, it grabs endotoxin, it grabs mycotoxins, et cetera, and takes them to the toilet. That's your prayer if you have CIRS. Dear Lord, please let this cholestyramine, Questran, well called, take these biotoxins all the way to the toilet. If you're not,
because a lot of it is those are stuck in the bile, right?
That's right.
Enterohepatic circulation.
Your liver packaged this biotoxin beautifully, stuck it in the bile. You have to eat healthy fats. Don't be scared of fats. Fats trigger the gallbladder to dump. And in the bile is the biotoxin. And the name of this medicine is called a bile acid sequestrant, or I grab that. And if you don't grab that, which activated charcoal doesn't grab it, bentonite clay doesn't grab it, zeolite doesn't grab it, et cetera, you will reabsorb that biotoxin-laden bile 95% through enterohepatic or gut liver recycling. And then your liver goes, whoa, I just dealt with you. And then your immune system goes, keep karate chopping. And that's called chronic inflammatory response syndrome. It's not chronic urinary mycotoxin syndrome. It's not CUMS. No. It's not chronic fungal infection. It's syndrome. It's not CFIS. It's CIRS, chronic inflammatory response syndrome. And you got to get those biotoxins to the toilet. So 1/3 of bile is cholesterol. 1/3 of bile is bilirubin, the yellow pigment, and 1/3 is bile acids. That's so you're going to grab some cholesterol, and that's why all of our patients on CSM are on healthy fats, on animal protein, and they eat it regularly. They use this as a cholesterol-lowering medication. And there is, if I was going to a desert island and could only take one thing to prevent heart attack and stroke, not deal with a tooth abscess or fix apnea or clean up the diet and get Cetos out, I could take one medicine. It's well called cholestyramine for preventing heart attack and stroke.
And just to clarify, it is not a statin, because I think a lot of people get confused.
No, it doesn't enter you.
Right.
It what it is a garbage truck. So what your liver gallbladder does is it puts a trash can full of trash on the curb. And if you're not on cholestyramine well call as a CIRS patient, you then pull that full trash can back into your garage and keep dumping biotoxin garbage on there. And you go, maybe the garbage truck will come through next week. You put it out and now this trash can's overflowing, right? What cholestyramine well call does is it comes out your butt the same way it went in your mouth, but it captures the biotoxin-laden bile. Now, bile acids also drive motility, gut motility. So if you grab the bile acid, the one thing that's super real about this medicine is your potential for constipation and slowing of the stool. So when we have a SIBO with CIRS and stuff like that, we're having them work with nutrition to make sure gut motility is fully intact, because SIBO, the fancy name for SIBO around here is swamp gut. You got swamp gut. We need to turn it back into a river. And you need to be flowing, right? We have a saying at Roots and Branches ABP, always be pooping.
Yep.
Right. and it's one a day to keep Dr. D away. I need that cholestyramine-laden, bound up biotoxin stool, one a day. And brick by brick, row by row, you get out of the exposure. I'm no longer sniffing in sewer gas or mold, or removing the tick toxin, Borrelia burgdorferi 1. So a lot of our patients with Lyme, they've killed the Lyme. There's nothing left to kill. They come with an IV port and they've been on 5 rounds of antibiotics and they still have CIRS, Chronic Inflammatory Response Syndrome, post-Lyme syndrome. You're having immune responses to the tick toxin that no one gave you well called cholestyramine with yet. And
so
if
it's
you
just recirculating.
It's just recirculating. And if you do it while you're, and always prime the immune system with the 4,200 milligrams of fish oil, but if you do it during your antibiotic treatment, you really have to make sure you keep the well called cholestyramine, cholestyramine away from mood meds, away from thyroid, away from your antibiotics, away from prescriptions by about 3 to 4 hours. So, if you're confused at how to fit it all in, That's what Lauren does all day. And
It's a
that's
whole
what our,
job trying to come up with that schedule, but it's doable.
but it's not a, but it's a joyous job when you anchor people and you
Yeah,
go, I know this looks super complicated, but let's simplify it. And that's what you
right.
do with Dr. Shoemaker's work. That's what I do, but you take it to another level of application, right? And where the health coach will rescue and heal healthcare is my job is to change healthcare from what you have to why you have it. Give an exquisite 3 to 5 page explanation of why, so a monkey could look at that and make the treatment plan, right? I'm going to explain it, but then I'm going to pass things to the nutritionist. I'm going to pass things to the CIRS coach to then say, okay, this is a lot. Right. Now let's sort it into the next 6, 12 months of your life and let's set some exciting graduation
Yeah.
dates. Let's get a hiking Kilimanjaro, that bucket list back on your list.
Yeah.
Right.
Get some joy back in.
Don't
Yeah.
sit at home and say, I'm going to be moldy for the rest of my life and suck my thumb. No, this is a vicious, violent, treatable illness. The Dorninger tribe travels. We know how to find new construction, hotels, and all that stuff. And that stuff that, again, Lauren and the coaching community who are in the strict adherence of Dr. Shoemaker's work, they do that every day. And those are the patients who I want to do a study to see how much better those patients do with a good CIRS health coach versus not.
Oh,
I can
yeah.
tell you anecdotally, it's night and day.
Yeah,
Right.
for sure. Because it's so
So,
complex. When you understand it, it's simple, but there's so
mhm.
much to understand that makes it complex that, people going through it are already having a hard time comprehending or remembering something from like 5 seconds ago. So to try to
We tell
listen,
our staff, hey, that new patient calling, they're neurocompromised. Highly
right?
likely, right?
Yeah,
So compassion, simple, sort it. And then you watch them like it's so hard to schedule and do everything. And then 3, 6 months out, you see the agency, the capability, the ambition and drive, the feelings of self-worth, the hopefulness, the decisiveness, the courage come back.
it
And
does. It
that's
does. Yeah.
that's why I get up in the morning. Like I know that is the most wonderful feeling to serve someone, to get a joyous, creative, decent quality of life back. It's
Yeah.
the best, you know. And
Yeah.
again, I just remind everyone like Lauren had days where she didn't remember who her kids were. She was totally disorienting, depersonalization.
Extremely.
If you have any kind of mood symptoms, you have to screen for CIRS. Doesn't
Yeah.
mean all mood symptoms are CIRS. It means it has to be ruled out.
It's why not? Why
Why
not rule
not?
it out?
Yeah,
Why
that's right. And you
that's
don't
always
do it
my
with urinary
argument. Yeah.
mycotoxins, and you don't do it with antibody test the mold. You do it with a VCS and a cluster symptom quiz. And we can circle back around and you can reach out to Lauren for more support on that. How do people find you?
You can find me, the biotoxinlady.cirs on Instagram. I've got my link in there to all my resources, my coaching, my consultations. If you want to reach out by email, that's perfectly fine. Lauren at thebiotoxinlady.com. I try as much as I can to get back to as many people as I can. And it gets harder and harder, but don't give up. Please reach out. I would love to connect with you and help.
Yeah, I've never seen someone so consistent with trying to help, and I'm glad you're hiring help because
Yes.
you're definitely a beacon. So will they find you at CIRSX?
I will be there. I'm excited
Yeah. So
for
we also
sure.
we also gave Lauren's followers a code. She might post that again over the next couple weeks. But CIRSX is in Tempe, Arizona this year, June 6th to the 8th. The proficiency partner training for providers who want to do your first level of learning is Thursday, June 5th. It is in a new construction Omni hotel. It is $149 a night hotel room. We haven't had a new construction hotel under $200 for a long time. The conference is $1,000 for 3 days of incredible talks of environmental and healthcare and health coaches and patients and lawyers and everything we need for this village to eradicate this illness. Our keynote speaker is Dale Bredesen, who wrote the End of Alzheimer's work. And then
Awesome.
our headliner second is Dr. Shoemaker talking on the link between Parkinson's and CIRS. And Lauren is just such a special human being to me because you have the most important thing to help serve this illness, and that's integrity
Well, thank
and
you.
street cred, and you're a mom. So I think it's really helpful when you working with families with peds that
Yeah.
so she's
Yeah.
brilliant and simple, and she's not going to talk over you. She's going to hold your hand, hug you up, and step by step piecemeal you to the finish line.
Well, I appreciate that. Thank you. And I have to throw it back to you. And I wouldn't be doing what I'm doing, and I wouldn't know what I know without you. So, I mean, that is huge. I mean,
Yeah, well,
I've
let's
learned
keep
so
the
much
village
from you.
growing.
I worked with your clinic. So I owe you. Yeah.
Yeah, well, all you owe me is watching you live your life, but we got to keep you away from those zip lines. Is all I'm going to say.
Yep. No, never again.
Yeah,
Keeping my
so
feet
I'm
on the
like,
ground.
we got you better from CIRS. Did that give you the ambition to do the zip line? No.
No,
But
bad
remember,
idea.
folks, quarter of the population in initial data set has predisposed genetics to get this illness. The buildings are atrocious. And that means there's about 2 billion people who may have CIRS. We need an army. Come join us.
Yeah.
And if you're hearing this, just reach out and we'll get you started on the clean path to an honest diagnosis and healing.
Yeah. And that code for the conference is the Biotoxin Lady. And if you can't make it, you can't come, you can't join, which is understandable. So many people are in the throes of it, but put it on the radar for maybe your provider and the environmental professionals that you're working with. That's how we
Yeah.
can change this. That's driving people to that, the professionals. That's how we can get this, mainstream.
And I'm glad you said that. The UK, we have a whole bunch of providers there. They're using some of those discount links to do the live streaming. So it will be live streamed. And some people are getting 3-4 people together, splitting the cost and doing streaming parties.
There you
They're
go.
getting together in
Yeah.
their PJs and just going to enjoy. And some people just aren't feeling good enough yet to
Yeah.
travel. And we invite you next year, but you can stream. And the key is to feel and realize there are people out there fighting for your life, for your
Yes.
answers, and to see the environmental and healthcare and health coach and legal and patient advocates come together. It's a buzz, and it refreshes me every year. But I also learn the latest and greatest
Yeah.
on how to micro tune getting patients better. So, well,
Exciting.
Lauren, looking forward to doing this again. I have like 100 more thoughts
I
and
know.
questions for you, but I know
Many.
now
Yeah.
probably time to wrap it up. So people are like, I love that podcast, my brain hurts. So,
Yes. We'll give them a break.
yeah, appreciate all you do, and thanks for coming on.